Hello, and welcome to another episode of Health Watch. If you have been tuning in this week, many of you will know that this is Nursing Week, and in honor of that, Health Watch will be covering various topics in nursing to celebrate how far the profession has gone and changed over time in Canada. And wrapping up this week, today we'll be discussing why research is so important in nursing. I will be speaking to several individuals who are at different levels of their nursing profession to get an in-depth understanding of the whole picture. Let's get started. Come on. Thank you, Tony, for being with us here today.
No problem.
So our discussion of the day today is why is research so important in the nursing profession?
Research does inform our practice. As we can see, the growth of knowledge from 1840, when childbed fever was caused due to the lack of hand hygiene, and presently we have many hand hygiene practices in place. The Hand Hygiene Guidelines fact sheet suggested washing hands with soap and water for 10 to 15 seconds when they are visibly soiled and using an alcohol-based rub when they are not. The nurse should wash her hands before and after interacting with the client. If needed, the nurse can use PPE, gloves, and a mask to protect herself and the other patients.
I've been laying in this position for 10 days. I think there's something wrong with my back.
You'll be fine. You just had your surgery. It's best to lay on your back. You shouldn't move at all. Just stay there.
So this is Lily, a wound care specialist for 25 years and a nurse for 30 years. So Lily, what can you tell us why is research so important in the nursing profession?
I'm surprised on what I'm seeing in the video, but we have changed over the years with the use of evidence-based practice, especially with clients who are bedridden. We have learned about the importance of repositioning our clients frequently by at least every 2 hours. This will help clients to relieve the pressure off their back, not to develop pressure ulcer. We have learned that adequate transferring or turning the clients is important to prevent shearing or friction against the client's back. With the use of Dostric to protect the client's back, research shows a client must have adequate nutrition and fluid intake to help prevent pressure ulcer from developing and to help heal their wound.
Thank you, Lily, for sharing this issue with us. Now, stay tuned. We still have one more guest. Hi, Ashley, and thank you for coming to Health Watch.
Thank you. It's a pleasure.
So, Ashley, it's Nursing Week, and our topic for the day is why is research so important to nursing? What can your expertise tell us about that now?
Pneumonia is currently the leading cause of death in nursing home residents, which is a particular aggregate of interest. The most common path of infection for typical bacterial pneumonia is the colonization of the oral cavity, followed by aspiration of these oropharyngeal secretions into the lower respiratory tract. Poor oral hygiene has also been associated with an increased risk of cardiovascular disease and low-grade inflammation. Research has guided the nursing practice and has been a major contributor for developing the best practice guideline for oral health assessment and intervention.
Truly amazing how research has improved our practice. Thank you for sharing this with us, Ashley.